Joe Burrow's night seems to be done after not starting the second half, after what seemed to be a pretty innocent and benign throw caused him to collapse down and grab at that right wrist. Welcome back, everybody. I'm Dr. Brian Sutterer, and my goal in this channel is to help teach you about the medical side of the sports world. So if anatomy and sports injuries interest you, then please consider subscribing. This was the throw where we really saw Burrow appear to be in obvious pain for the first time. Nothing abnormal happens here. Sometimes when we see quarterbacks get injured with a throw, their arm gets hit is usually what we see. Something gets hit with the thumb on the follow through, or as they're following through to accelerate and release that ball, their elbow gets hit and there's some force put through their hand or their elbow. Here we don't see anything like that with Burrow. Rather, as he releases the ball, we just see him grimace in some obvious pain here and then kind of collapse down. His right pinky does look a little bit abnormal here with how much it's abducted or positioned outwards. We'll talk about the pinky in a little bit, but clearly seems to be in some significant pain, grabs at that wrist, and that's really all we could see occur. There wasn't really much else on this individual play, but certainly grabbing at his wrist in some discomfort. As we saw him walking off the field, again, he seemed to have a hard time wanting to really extend or straighten out that pinky, just kind of holding his wrist stationary, not really wanting to move what it seemed like was some pain he was dealing with, appearing to be in that pinky, or what we call this ulnar side of his hand and wrist. This was the play before that where there was some contact. And again, we don't see anything abnormal really hit Burrow, at least on his follow through. Now, the Ravens player maybe hits his elbow a little bit right here, but hits him on more the outside or that back portion of the elbow, not on the inside part where I would expect to see something happen with the ulnar nerve, for example, because one thing we'll talk about is that ulnar nerve with kind of the differential here. As Burrow follows through, I will say his pinky looked kind of funny here. I don't know if it was just me, but as his hand is kind of coming down, look at what we're seeing with his pinky. It looks like it's just awkwardly kind of hanging out to the side right there, almost like it's going in a complete opposite direction from the rest of his fingers. This way, his pinky is completely like way out to the side. And then even as he's releasing the ball, when he comes through here, it just looks like his pinky is kind of hanging out along for the ride and not really following the same pattern of the rest of his fingers. So I'm starting to think more, looking at this at least, potentially some injury to the tendons or going through the wrist out to the control of the pinky. Next, I want to dive into what we saw on the sidelines with him trying to throw, walk through a little bit of the differential given what we know about his evaluation. But first, I want to give a quick shout out to the sponsor of today's video. Today's video is sponsored by Ada. Did you know that there are treatments now available for COVID-19? Yep. That means there's something you can do if you catch it to avoid getting really sick. COVID-19 is still a very real risk in our world. And with the winter and colder months coming up, COVID-19 cases can be on the rise, especially as we're all spending more time indoors with loved ones and the holidays. And that's why it's important to know that you or your loved one could get treatment for COVID-19 if needed. All you have to do is take Ada's free health questionnaire to see if you're at high risk for developing COVID-19 infection by clicking the link in the description below. Their free questionnaire guides you through questions about your medical history, your age, and other factors that help in determining whether or not you're high risk and may be eligible for specific treatment. If eligible, you get connected with clinicians in telehealth to learn more about COVID-19 treatment options. Taking charge of your health this holiday season is just a smart move. Ada's free health questionnaire is trusted by clinicians and a smart and easy way to find out everything you need to know about COVID-19 and if you might need treatment. As a doctor, I can't stress enough the importance of proper COVID-19 management and understanding if you're high risk and might be somebody who needs specific treatment. I trust Ada's questionnaire to give you the best guidance for yourself and your loved one this upcoming winter and holiday season. Thank you again to Ada for sponsoring today's video, and let's get back to our learning. So then on the sidelines, we see this from Burrow. He's trying to throw the ball, and pretty much right away as he gets to this point where his elbow is really being loaded, he just completely drops the ball. We don't see as much abnormal stuff out here going on with his fingers in this position, but really acts almost to me more like what I would expect in somebody who's dealing with like an elbow injury, specifically a nerve, with just the way he essentially wants to just drop that ball and can't even really put any stress or grip through the elbow. The other little sleuth thing I want to point out here is I don't recall Burrow wearing one of these elbow pads on his elbow. And so this seems to be something new, and we see something new, protective. It makes me wonder about some type of injury, some type of trauma that he could be trying to protect and deal with. So then to wrap up this whole evolution, we see Burrow come back out for the second half with no immobilization, no brace, no ice, nothing on that right wrist or finger. Things don't look particularly swollen. Finger position looks pretty darn normal. So this is all a little bit bizarre, to be completely honest. What made me think first off about potential ulnar nerve injury is that ulnar nerve runs along the inside of your elbow. And whenever you're a thrower, sometimes that ulnar nerve can sublux or snap across a bone called the medial epicondyle. and cause a lot of paresthesias down into your hand, specifically your fifth and fourth finger. That's what happens whenever you hit your funny bone. And the way he kind of shook out his hand, was opening and closing, makes me think about an injury to that ulnar nerve. Now, the ulnar nerve can get injured. It can snap up at the elbow. Maybe Burrow was dealing with that. Maybe that's why he's wearing an elbow pad. The ulnar nerve also goes down through the wrist. It specifically goes through a part of the wrist called Guillen's canal. And if you have anything like a fracture in, for example, the hamate bone or any of these bones on the volar side of the wrist, you can irritate that ulnar nerve as it's passing through Guillen's canal and still cause some of that weakness and paresthesias in that distal upper extremity. So I wonder about the possibility of that in terms of why they're calling this a wrist injury, but it almost presents more of like that hand numbness tingling sort of a thing. We have to be detectives here, right? Because presumably at halftime, they've gotten some x-rays of Burrow's wrist. If there was something fractured in his wrist, he'd be immobilized. He'd be in a splint. He'd be ruled out. So presumably x-rays were negative. However, on x-rays, you can't see tendons. You can't see cartilage. You can't see ligaments. And so presumably having a normal x-ray means an injury to the bones is much less likely. That then makes me think about injuries to the tendons or to the nerves. For example, there's an area on this ulnar side of the wrist called the TFCC, triangular fibrocartilage complex. It's sort of like a meniscus sitting inside that ulnar side of the wrist. And that can be injured specifically with trauma and can cause a lot of that dull ulnar-sided wrist pain. So that could be a potential for what Burrow might be dealing with. However, I'd lean a little bit more towards the tendons, specifically maybe the tendons that extend and straighten out the pinky. Those tendons, specifically the extensor digiti minimi for the pinky, run along the outside of the wrist, up through the backside of the wrist in a little specific groove of the ulna, and then all the way up out to the elbow. So maybe the elbow pad was because of some irritation in those tendons, maybe extending down into the hand. But again, this is certainly bizarre because we'd expect some sort of immobilization on Burrow's wrists if this is still in fact a wrist injury and not an elbow nerve injury like I initially suspected. Even if all Burrow had was a finger dislocation and he was going to be ruled out, you'd expect him to be buddy taped or something done to protect his finger. So there seems to be something else going on here. I don't know if the Bengals are trying to downplay this because of what we saw with Burrow seemingly wearing a splint on his wrist before he showed up to the game, but this is bizarre. Hard for me to say 100%. Again, I think about ulnar nerve just when I see throwers kind of drop the ball, not be able to grip. The deformity that we saw in his finger made me wonder about something like a tendon injury or a ligament injury within the finger or the extensor muscles, tendons up in the elbow. And then wrist-wise, if that's truly where this is, presumably x-rays were negative. So then I think about things like TFCC tears, cartilage injuries, ligament injuries within the wrist. The other final thing I'll mention is it almost looked like Burrow was saying on the sideline something about a pop or feeling a pop. After throw, feeling a pop, that's usually not something in the wrist. Now, whenever you injure your UCL up in the elbow, that can cause some transient ulnar nerve irritation, that kind of numbness and tingling. So potentially something to keep on the differential, but again, I don't know why they would call that a wrist injury. So either this is entirely incorrect reporting by the Bengals, or we truly just don't have a clear sense of what's going on here for Burrow. I wish I had a better story. I wish I had a better example, but sometimes I think it's interesting to still think through in real time all the things I'm trying to process, especially for you folks out there who are a little bit more medical minded and know a little bit more of these intricacies. Let me know down below what you think this could be. Do you think it's his nerve? Do you think it's his wrist, finger injury, tendon injury? What in the world do you guys think is going on from watching the videos? But anyways, thank you for watching. Let me know as always, question or comments. And until next time, we'll see you later. Bye.